right, we're back for another episode of the Healthy Chicago podcast. I'm your guest host today, Dr. Alex Sloboda. I'm the Medical Director of Immunizations and Emergency Preparedness for the Chicago Department of Public Health. So today we have a big topic. We're here to talk about the 2025 COVID, flu, and RSV vaccine guidelines for Illinois and Chicago. We're grateful to have two extraordinary leaders in public health with us today for the city of Chicago and the state of Illinois. We have Dr. Olusimbo Ige, our CDPH Commissioner, as well as Dr. Vohra, the Director of the Illinois Department of Public Health. So we know there's a lot of confusion concerning COVID-19 vaccines, and it should be some are saying it should be restricted to only high-risk people. There are parts of the federal government that say only seniors and people at high risk should be given the vaccine, and everyone else needs to discuss it with their doctors. So you both say you recommend the COVID-19 vaccine to pretty much everyone. Dr. Ige, if we want to start with you as the Commissioner of CDPH, you are the doctor for the city of Chicago. Why do you say everyone benefits from the COVID-19 vaccine and should receive it?
Well, thank you, Dr. Sloboda. I'm a public health physician, so my patient is the population. So my view is that of looking at the entire city and using the lessons we have learned about what is protective of public health. Every year, over the last 5 to 6 years, we have seen COVID infections. It is not discriminatory. Everyone from infants to 90-year-olds get COVID. So based on that, I believe everyone can benefit from that protection. I like to use an analogy. Everyone benefits from wearing a seatbelt. It is not just those who are sitting in the front seat or the driver's seat that benefit from it. They are the closest to the danger. And yes, they can wear the seatbelt, but if you're sitting in the back seat, now everybody in a car benefits from wearing a seatbelt. So that's sort of how I think about COVID. It can impact everybody. There are those who are at higher risk, but everybody benefits from that protective intervention that vaccines offer.
Yeah, no, that's a really good analogy. Thank you. Dr. Vohra, you're the doctor for the state of Illinois. Why do you recommend a broader approach rather than a more restricted approach to COVID-19 vaccines this season?
As Dr. Ige said, and just a pleasure to be on the Healthy Chicago podcast, and it is just a really important question. And I think for us as public health leaders, the importance of following the critical processes to understand the data and risk that's out there to make the kinds of recommendations that Dr. Ige talked about. And our process here in the state was really to engage with the data, with the experts, and understanding the idea that COVID is in itself sort of an evolving virus. We have become used to the idea that the flu changes each year and you need a new shot to protect you for that season. And those seasonal vaccines are different than the routine vaccines that we get. We don't talk about it much now, but we used to. All the time we would get headlines about the absolutely new variant that was out there and knowing how that would change and evolve, and it would change in the way that our body treated it. And we know that COVID, similar to the flu, has these new variations, and the seasonal shot is built to protect you from that latest variant. So I think, one, that's an important factor. Two, I agree completely with Dr. Ige, the importance of when we think about the public as opposed to the individual, it's really important that the community, the city, the state is protected from COVID-19. That helps the individual who received the shot. It reduces their risk of getting severe COVID-19, but also helps those around them. And in the risk-based approach, it is also sort of on the idea that we all know the risk factors that we have. And sometimes we do, right? We know that sometimes people are older, sometimes people know they're immunocompromised or that they have a chronic medical condition, but we also know that many don't. And this universal recommendation for adults allows the ability for people to have that opportunity even if they don't know what their risk is. And one of the important things as we went through that process and sort of spoke with our experts, the Immunization Advisory Committee, it was that real approach that the reason we're okay making this universal recommendation is because we know that COVID-19 is effective, and most importantly, we know it's safe. And that allows us to protect individuals with this recommendation, protect populations, and allow people to have the protection with the latest variant of the COVID-19 virus.
That's really helpful and covered a lot of questions we've been hearing about this universal versus risk-based approach, and people have been hearing different recommendations from various different organizations and levels of government. Can you talk a little bit more about this process that occurred with the Illinois Immunization Advisory Committee? I know it's been around for a while. It's going to be very critical in our future for the state of Illinois. Can you go into a little bit for those who are not familiar with it?
Absolutely. I think part of what moment we're in is that we, public health departments, state public health departments, used to look very clearly at the CDC Advisory Committee on Immunization Practices. We know that this committee analyzes data for all kind of vaccine preventable diseases, able to really examine both the information and the products to make the recommendations for the entire country. But what we saw this summer was something that was truly unprecedented. The Secretary of Health and Human Services, Robert F. Kennedy Jr., he asked every single individual of that advisory committee of immunization practices to resign. That included one member of our Illinois Department of Public Health team, our immunization chief, Karen Lyons. And part of that is that when you dismiss the entire group, when then you bring people into that committee that there were real questions about their views, their credibility across medical circles, what it creates is now a process that was respected and trusted by everybody, a gold standard process that was trusted by, as I said, state, local health departments, but also as a general pediatrician. I didn't have to worry because I knew those processes were based on reputable scientific evidence and they were credible and transparent. And so that we knew now there was a little bit of a vacuum and that recommendations would come out that we may or may not trust. And also, as we saw those committee meetings happen, the way the conversation happened, the data that was used to support certain findings were not part of that gold standard. So what we have here in Illinois is an immunization advisory committee, and one that we were fortunate to have some pretty dynamic members, but they weren't in the business of making vaccine recommendations because it was practice for us trusting that federal process to stamp that as the process here for Illinois. And that changed, and we knew that we wanted to bolster that committee. And we're fortunate here in the city of Chicago, in the state of Illinois, to have national and international experts, people who are leaders around immunology, vaccinology, OB/GYN, pediatrics, family medicine, local health department leaders, bring their expertise to have conversations about what our statewide recommendations should be. And we wanted to have that be an open meeting where people could hear that dialogue, so that this was not being made in decisions made in a back room, but decisions made by that committee through open dialogue. And some of the things that we just talked about, risk versus universal, came up. I don't think we knew exactly where this committee was going to go. But what we found was really dynamic dialogue and things that really brought to the front of the surface the idea that a universal recommendation was best, and the thought that it really made us as a state to align with specialty society recommendations, because the American Academy of Pediatrics understand they have the pediatric minds. The American College of Obstetrics and Gynecology has those OBGYN leaders and researchers, and that's what the committee ultimately went with. That next day, I was able to approve those recommendations and then build a standing order around them. And that standing order and this committee would not have been possible without the governor's leadership issuing an executive order to create a statewide vaccine initiative for us in the Illinois Department of Public Health with our state colleagues to really make sure and raise up the importance of vaccines and having an all-of-government approach to making sure that we provided the recommendations and helped enhance the access to critical seasonal vaccines, and then moving forward, potentially more vaccines depending on the decisions of the Advisory Committee on Immunization Practices.
Yeah, thank you for explaining that all, because there's been a lot going on and a lot of confusion, but we're really appreciative that the state of Illinois has been able to kind of step up, continue to provide evidence-based recommendations, and doing it in a clear, transparent way for people in Illinois and Chicago to understand. Dr. Ige, to you, I know you're always talking to Chicagoans. There's a lot of confusion and even controversy around COVID vaccine. What are some of the things you've been hearing from Chicagoans? What are their concerns? What are the barriers? And what do you tell people that are just like unsure if they should get a COVID vaccine this fall?
Yes. There are many people who are wondering how to make a health decision. There are those of us who went to school and spent many years in school to learn medicine and then to learn public health. And then we spent every day looking at the data, because every hospital in Illinois, every hospital in Chicago that is treating people for different illnesses, we get to see the data. So we have a lot of information about what is appropriate, what is working, what is not working. That is not always available to the average person on the street. So people are struggling with, how do I know that this is safe? How do I know that this is good? And so let me start with a question of safety, because people are worried about healthcare systems. Is this safe? Are these recommendations good for me? And my simple answer to that is, it is safe. How do I know? If you look at how many people around the world have been vaccinated with the COVID vaccine, it is billions of people. If they were dying or something untoward was happening, we will see it. When people were sick with COVID, you didn't need anybody to tell you something was going on. I had neighbors, I had family members, I had friends who succumbed to COVID. So if this thing was killing people, it cannot be hidden. It will be evident. What we know is that millions of people got COVID vaccine. Millions of people got better. COVID vaccine hospitalization has reduced. Mortality has reduced after the vaccine started. Things didn't get worse. Things got better. So that's making it very simple, because I can talk data and all of that. But in simple everyday terms, there was a time when we couldn't come out. There was a time we had to wear masks everywhere. Now the vaccines came and 90% of people got vaccinated and things got better, not worse. So yes, it is safe because of the evidence and the experiences around it. It is also safe because of the rigor that went into evaluating the vaccines. We have had vaccines for more than 200 years. I have seen vaccine administration in many different contexts. My children, my parents, myself, we have received these vaccines. If you go to school in the United States, you are required to take vaccines. And nothing bad has happened to our children and our parents that have taken this vaccine. So again, it is safe from this evidence. We see the data, we see the rigor that goes into monitoring vaccination, and we're tracking the data. So those who do this as their full-time job are showing us the data and saying it is safe. The other thing that people are wondering about is why COVID? Why not flu? We receive flu vaccines every year. It's been around for several decades. It is the same recommendation for COVID. Every year we update the vaccine, take the vaccines, and we've had a lot of experience with flu. So why is COVID being singled out? That's the question that I ask people. Because it has been politicized. It is not because the science is widely different. It is not because the impact is widely different. It's respiratory viruses that have very similar characteristics with flu, but this has been politicized in a way that has singled out the COVID vaccine in a different way. So we want people to listen to those who know this field of work. I like to use analogy so people can relate. If I want to fly in an aircraft or in an airplane, I will go to someone who is certified for commercial, as a commercial pilot. It is different from, I'm flying for personal fun. If you're commercial, you're responsible for people, then you have to have a certain threshold of qualification. I'm not going to go to someone who read it on the internet. I'm not going to go to someone who said, I learned to fly from reading a book. You have to go to someone who's certified. The doctors who are certified, the vaccinologists who are certified, the immunologists who are certified, the public health experts who are certified, are all coming together. Association of pediatricians, association of obstetricians, association of public health folks, saying the data, we are the ones who are certified. We are the ones who have studied this. We are the ones who have the data saying to you it is safe. So these are some of the things that I keep reiterating to people, that don't take medical advice from someone who's not a doctor. Do not take medical advice from the internet. Take advice from those who have studied and are the experts in this area. And we are saying this is a good thing for you to do to stay safe. The last thing that I've heard is, well, I have seen a lot of people get COVID and they didn't get very sick. Do I need to bother? That may be so, and we're glad that COVID is not as severe as it used to be. But what if you get COVID and you go home? My mother is 89 years old. If I get COVID and I don't get very sick, and then she gets COVID from me, she can get very sick and die. And I can pass on COVID to those who are around me. I have friends that have immunocompromise. They can get sick and get very sick. So the public good of everyone getting vaccinated is such that we recommend this to everyone, because it's not just about you, it's about your family, it's about your friends, it's about kids being able to go to school and kids not taking, infections home to their parents and grandparents, which happens a lot. So overall, we feel very confident that, like we have experienced in previous years, the vaccines have been beneficial. They are safe, they are protective, and we want to continue to encourage folks to listen to the expert when it comes to making public health decisions like this.
And Dr. Vohra, particularly as a pediatrician, I know there's been a lot of focus around COVID vaccination in children and pregnancy. Do you have anything else you'd like to add, particularly around getting children vaccinated against COVID-19?
Yeah, and I think it is something, as Dr. Ige said, that it's okay for people to have questions, right? And I think as a pediatrician, right, like that's how you earn trust. You welcome those questions, and then you provide the best guidance based on, to Dr. Ige's point, that the study and knowledge of best practices. And it is something that for us, it was really important to, match our recommendations, and the Immunization Advisory Committee mentioned this too, with the American Academy of Pediatrics. And that recommendation that all children from 6 months to 2 years, recommendation for all of them to get a COVID-19 vaccine. We know from, as Dr. Ige mentioned, the hospitalizations, that group is at the biggest risk for having severe disease. And then going through the information, the work of the American Academy of Pediatrics, the extensive sort of literature on it, that was then to think from 2 to 18. It was a little bit based on some certain risk categories. One, if you had a kind of risk factor condition, right, and the list there on the CDC. If you've never had COVID-19, because we know that that sort of builds some immunity there. And then we also understood that the data showed that for families, caregivers who wanted to give their child a COVID-19 vaccine, that because we felt that it was safe and because the data showed, to Dr. Ige's point, that it was safe, that was a mechanism that would protect others, right? And also provides some data that a COVID-19 vaccine helps prevent long COVID too. And so there are those other indicators for a child, slightly different, not the same kind of universal recommendation as adults, but gives everybody the opportunity to have a COVID-19 vaccine. But really those individuals from 6 months to 2 years that have had risk factors and then have never had COVID-19 before.
Yeah. And then lastly, but in terms of COVID-19 vaccine, there's been a lot of concern. There's a lot of people that want to get vaccinated and are just unable to find it for themselves or their children, facing barriers either with the FDA license, barriers at pharmacies. I know the executive order and then your standing order has hopefully been able to overcome some of those barriers for people in Illinois and Chicago. But do you have anything else to add to Illinoisans and Chicagoans about what are the options this season, particularly if you're finding barriers at the traditional places you've gone to get COVID vaccine the last couple of years?
Yeah, we know that it has been a little bit of a challenge and sort of growing challenge over the last couple of years too, right? That as Dr. Ige said, when we were at the height of the pandemic and vaccines were available, there was a rush and there were so many different avenues. Part of the goal with this standing order was to really, allow that access in pharmacies and other areas where we thought there would be a little bit, more difficulty. I think one big challenge, especially early in the season, was that we mentioned the recommendations of the advisory committee and Dr. Sloboda, as you started, that it's sort of this individual kind of choice for 6 months and over. We were mentioned that the federal government would cover those, but it needed the approval of the CDC director to do that. And that, only happened kind of right at the beginning of last week, right? And so that, opened up some more opportunity and access. The Vaccines for Children program, exactly. And also the other element here that we know is that the national insurance organizations also came out in the last few weeks to say that they would recommend that all of their plans, cover those shots as similar to kind of, last year's recommendations as well. What is a little bit of a worry, though, is that what happens in subsequent cycles. Because we know that making a COVID-19 vaccine, it requires a lot of partnership with the FDA the vaccine manufacturers are going to want the ability to understand that their vaccine will be approved, that it will be covered. And of course, those important scientific processes to ensure that it's effective and safe need to be there. But the kind of continued concern. So I'd say to Chicagoans and Illinoisans, there are more things have happened in the last couple of weeks. If you early in the season, if for whatever reason your pharmacy or your doctor's office didn't have them, more opportunities should exist. There's a vaccine locator through the Illinois Department of Public Health website too, and continuing to help provide people the access that they need to this critical, seasonal vaccine.
Dr. Ige, for Chicago, I know CDPH has been doing a lot of work getting ready for the season, planning all these events. We got our walk-in clinics. What are some of the options you want to highlight to Chicagoans of where they can get COVID vaccine this season, especially if they're facing barriers?
Yes. At CDPH, we just like to make things easy for people so that people don't have to overcome a lot of barriers to get access to health promoting interventions. So we know that in Chicago, people prefer to get their vaccines at pharmacies. So right now, based on the standing order, we know that vaccines will be available at pharmacies for those who want them. Now, if you have insurance, we're glad that insurance companies will cover it. Now, the second option is if you don't have insurance, then pharmacies may not be the best option for you. So we, CDPH, we have immunization clinics that's available for those who don't have insurance and other people who may not have ready access to pharmacies. We have vaccination events where we bring vaccines closer to people, to senior centers, at our city colleges, for family vaccination. You want to come with your entire family. You don't want to schedule an appointment and go all the way to Roseland Clinic, etc. We want to have community events where vaccination will be available. If you have a pediatrician where you usually get your vaccination, we're also working with them to ensure that providers, healthcare providers have vaccines available. So regardless of what your preferences are, pharmacies, community-based, clinic-based, or with your routine provider, our hope is that everyone in Chicago knows that they have access to vaccines and that everyone knows that we recommend these vaccines for them and that these vaccines are safe because we're taking them ourselves.
Yeah, we have those clinics and events where people can get both COVID-19 and flu vaccines. And so thankfully, flu vaccines have not been as difficult this season, but we know we had a really bad flu season last winter. Dr. Vohra, can you talk a little bit about, are there any changes or recommendations for flu vaccines this season, and why is it still so critical people stay up to date on their seasonal flu vaccine?
Well, as Dr. Ige mentioned at the start, right, that we have become used to this idea that it's time for your yearly flu shot. And, excited, can't wait to see the role of you taking your shot. Often it's a little bit of a road trip and so during my time I've been able to take the flu and COVID in East St. Louis 1 year, in deep Southern Illinois another year, Champaign, Illinois. And so we're working out to be determined where we'll get the COVID-19 vaccine and the flu vaccine. But part of it's this protection, right? And all the things that we just said about COVID-19, true for flu. New strain. We know that flu can be devastating for certain people who are at risk, and the importance of protecting yourselves, your family, your community by getting a flu shot. Fortunately, the Advisory Committee on Immunization Practices back in the summer recommended a universal recommendation for the flu shot. 6 months and above, when the state of Illinois made its recommendations through the Immunization Advisory Committee, we recommended exactly the same. And so flu recommended for everybody 6 months or older. And the access in pharmacies, in your local healthcare provider, and a really way to get you safe because we have known and as you mentioned, Dr. Sloboda, that flu rates have been increasing during these last few seasons, and we want to make sure that people are safe at home, especially as we get to the holidays too, to protect themselves and their loved ones.
Thank you. Yeah. Dr. Ige, anything else you want to add about flu? Thankfully, not as complicated, but
Yeah,
still
flu.
very important.
Yes, flu is still here. Every, respiratory season, every year we see it manifest. People still forget to take their flu vaccines. This is a strong reminder that it is here. Flu still puts people in hospitals and flu still kills people. So we don't want you to take any chances. Your life is so important and the holidays are just the best. So I tell everybody, get it all out of the way so that when it's time for the holidays, you're all squared away. So that's my encouragement to everyone. Again, remember that you can take both vaccines at the same time, flu and COVID. So yes, you'll be sore for a few days, but it's worth it because I'm looking forward to holidays and having fun and not being, sick during the holidays.
Absolutely. Don't miss out.
Mm-hmm.
It's our campaign. And then lastly, we don't want to forget about RSV. Dr. Vohra, can you tell us a little bit more about RSV? It's been around for a very long time, but I think people are starting to hear about it more in the last couple years. Can you tell us about what it is, who's at risk, and what are some of the options for immunization?
So yeah, RSV, respiratory syncytial virus, and partly what this virus does, especially for little babies, is that those small airways that we have, it can really create the kind of infection in those that make it difficult for babies and then sometimes older adults who can also get really sick from RSV. And as a general pediatrician, you would see RSV quite often. And for most of my career, there was no vaccine to prevent it. And we've been very fortunate over the last few cycles that all of a sudden we have now a third vaccine to help us deal with respiratory seasonal viruses, COVID-19, flu, and RSV. And so RSV is recommended for all babies 8 months and younger. If they did not get an immunization, their mom didn't get it during pregnancy. And that's recommended between 32 and 36 weeks of pregnancy. And then kids who are 8 months to around 2 years, 19 months to 2 years, those are ones that often having, if they didn't have one last season or they have sort of risks, are things to be thought about and considered, and an important place to have that conversation with your physician. We also said, though, it does affect adults too, and that, similarly the way that flu and COVID-19 for people who are older, you can get pretty sick from RSV. And so it is recommended for everybody 75 years and older. And then for those that are 50 to 74 that have a risk factor too, because if you have that risk factor, you can get sick. And so those are kind of the third of this trio now of vaccines that have the ability to help reduce the burden of a seasonal respiratory virus that can get you sick. And it's really great because having taken care of so many families with kids that needed to be hospitalized with RSV, it can be incredibly disturbing, challenging. As Dr. Ige said, we all want to be healthy and enjoy our families. Not having our young kids in the hospital for RSV, and this kind of vaccine can really help reduce the chance of a child being hospitalized for RSV.
Yeah, absolutely. Yeah, working in the emergency departments, it's very scary seeing young infants come in with really bad RSV infection. They can't breathe, they're wheezing, they end up in the pediatric ICU. It can be very scary for for parents and everyone involved. So it's great now we have something preventative to prevent that's very effective and safe as well, preventing the severe RSV infection, especially in the little newborns. Before we close out, is there anything else you want to add about flu, COVID, RSV vaccine?
Well, the Chicago Department of Public Health, we are your partners in public health. We're your partners in health protection. And so if you have questions related to vaccinations, if you want to see what the numbers are of COVID and flu in our city, we have a dashboard for you that is updated very regularly. So you see how many people are getting sick, are we seeing COVID in the wastewater, etc. So that information is available and it's transparent. And we also vaccinate people, and you'll also see those numbers there as people are getting vaccinated, just so you see that you are in good company. And if you want to learn more about vaccines or see what the city is doing to protect Chicagoans, we have information always available for Chicagoans who want to know more. If you have other specific questions related, we have a Healthy Chicago email that you can send an email. Again, we are city employees. We're public servants. Our job is to provide you information or get you connected to the right information, whether that is flu or COVID or RSV or anything else that is health related. We are your go-to source for information. And Dr. Sloboda here is going to be leading all the vaccination events for the season. So I just want to be appreciative of all of the work that he does every day on the ground, making sure Chicagoans are safe. We also have experts in our department who are there every day. He's going to give me my shot. And so he's giving people shots every day so they can tell you real time and what they see on the ground. So it is not just what we're reading from the books or the data, is that we have real folks who are doing vaccinations every day on our team who can tell you more about what they see every day.
Absolutely. And IDPH has some dashboards as well, correct?
Yeah, we have our respiratory illness dashboard, dph.illinois.gov. Right in the front is just sort of our immunization page, specific information on all the guidance that we just talked about. And for those that have questions, our goal is to be a place where you have credible, transparent information that you can trust to make the decisions, because we know that these decisions are so important for all of us on how we can be safe and protected. And so appreciate this opportunity to kind of engage and join the Healthy Chicago podcast. I think we're so fortunate to have such a strong partnership in Illinois with the city of Chicago, but with our local health departments across the state, knowing that public health stays connected, because we're all wanting to do what's in the best interest to serve our residents all across Illinois.
Absolutely. Now that fall is here, there's a lot going on in the city of Chicago and the surrounding areas. So after you get your flu and COVID vaccines, what are you looking forward to doing in the Chicagoland area this fall?
So much. And, it's exciting. We know that, the Bears season is starting to look more promising. And just, I think we all cherish, as Dr. Ige said, the holidays, being able to enjoy the amazing kind of decorations, and the city just, continues to sort of come alive. And so excited about enjoying the city and the state overall, and doing my best to protect the loved ones in our family so they can be protected too.
Yeah, my children are older now, so but I still get a lot of fun from Halloween and seeing the kids dress up. So I'm always looking forward to that. Apple picking also is something that I enjoy doing, just to unwind, and to drinking too much pumpkin spice as well. So many things to look forward to this fall.
Absolutely. Wonderful. All right. Well, that's our episode of Healthy Chicago podcast. Thanks for joining, and we'll see you next time.